Hi everyone, we're on to topic 5.2, communicating with children. So in this topic, I'm going to discuss the differences in communication between adults and children. I'm going to talk about Piaget's stages, but I'm not going to go over the slides describing the stages. Instead, I'm going to concentrate on the communication strategies best used in each of these strategies. Just to save time, I'm trying to keep these videos to 10 minutes or so. I'm going to identify and describe how parents feel children often react and offer communication strategies to use when communicating with them. So at some point in your career, you're going to deal with children. You'll soon learn that children have unique communication skills and needs. Whereas adults have years of experience, children have limited life experiences. So a visit to a hospital is a new experience and can be the first introduction to the healthcare system. So it needs to be a positive one. We know that a child's psychosocial and cognitive development affects their ability to understand and communicate. So we need to alter our communication strategies accordingly. We would not talk to a toddler the same way we would talk to an elementary school student. And an understanding of growth and development is helpful to address the communication needs of children at various ages, and that's why we're looking at Piaget's stages. So children have less life experience, still developing who they are, still developing their social skills. They have shorter attention spans, and that's very true as the younger they are. They need greater direction. They're not self-directed learners like adults. Children have smaller vocabularies. Their vocabularies grow as they age. And they have a more concrete black and white view of the world. Some things can be all good, all bad, and we need to take that into account. So Piaget describes ways in which a child thinks and behaves at different stages of life, and we're going to look at those stages briefly. So we have the sensory motor stage, which is ages 0 to 2. Pre-operational stage is 2 to 6 or 7. Concrete operational stage is 7 to 11 or 12, and then the formal operational stage is 12 to adulthood. Now, in your PowerPoint presentation, you have descriptions of each one of these stages, but I'm not going to go through those. I'm just going to go to communication strategies. But first, we need to assess our communication skills. So growth and development is very individual. Just like adults, not all children are alike. So we need to assess their communication skills when we meet them and tailor our strategies to their needs. Piaget describes the usual patterns of communication. However, each child will be different because each child has had different life experiences. A child who has spent a lot of time in a hospital will react very different to a child who has never been there before. We also need to assess the interactions between the parents and the children. Are the interactions age appropriate? These interactions will often give you insight into how a child is responding to their illness. So while one of the hospitals I worked with, we gave a stuffed animal to every child who was admitted to the hospital. These were donated by the volunteers, but they helped the child feel comfortable. Also, inquire about terminology the parents and child use to describe body processes. They may not understand the terminology that you're going to use. You should also observe, interactions between the parent and child. Are child's interactions age appropriate? Is play organized, or is child unable to complete activities? Establish a baseline when strategizing to meet specialized needs of each child. Establish baseline, then strategize. Sorry, I was trying to read the sentence incorrectly. Then strategize to meet specialized needs. You're going to want to take all of that into account when you're developing your plan on how you're going to communicate with each child. And keep in mind that an ill child will act very differently when they are well. So communication strategies for the sensory motor stage. Remember, these are 0 to 2. So acknowledge parents first. The infant child is looking to see how they react to you first. If they see that the parents are comfortable with you, then they'll also become more accustomed to your presence. Ask how parents provide care. You have bathing, sleeping routines, holding them. They like movement, so stroking, touch, motion, freedom of movement. They like to move. Hold close, 8 to 18 inches, face to face. Talk to infants in simple language and move to the child's eye level. We often forget that a towering presence like adults, what a towering presence like adults are to children, and how intimidating we can be. So move to their eye level so that the child feels there's a more equal footing in the situation. Remember, nonverbal communication is so important, as they may not understand what you're saying, but they'll definitely understand the tone of your voice and your gestures that you're making. Now, the pre-operational stage. And this picture is my babies when they were little. So at this stage, the child remains very concrete in his or her understanding of the world. They've yet to develop abstract thinking, sorry. For this reason, saying things like, I'm going to take your blood pressure, can be perceived as something being removed from them. So just think creative ways in which you can say these terms. Be brief and clear. Use their language. Giving too much information too early on can just produce anxiety in this group. Short, simple sentences right before you do something is best to avoid their imagination going wild with the possibilities of what you're going to do to them. Can you imagine? Cope through play or storytelling. Children love to be creative. You know, a crying child can often be soothed by letting them express themselves. Give them some crayons to play with. Remember play is how a child learns and copes with the world. Provide encouragement. Always provide encouragement. Encourage parents to do so as well. It adds a positive element to an experience that can be quite negative at times. Get the parents to help and have them bring in familiar objects. Having the parents around and bringing in familiar objects can make the child feel more comfortable in an unfamiliar space. Allow the child time to process what's going on. Give them a few hours to process what procedure's coming up. Tell them and let them kind of think about it. Role play with toys. They can often benefit from playing with toys and dolls before a procedure. Motivated to learn, so provide encouragement. Talk directly to the child and explore activities that are meaningful to the child. However, avoid touching the child whenever possible, or ask permission to touch a child from the child or parent first. We're moving on to the concrete operation stage. By the time a child's 10, they should be able to organize information. They should be able to organize the information you give them into a sequential manner. So always organize what you're going to do. Give it a time frame. Establish boundaries for all ages except infants. These established boundaries for expectations of behavior, what you kind of expect them to be like. Be consistent. Relate consistently with consistent expectations. You know, just like you would with your own children or Be consistent. Encourage laughter. Jokes are so much better understood now, and it kind of lightens the mood. And validate their perceptions and emotions. Now on to the adolescent stage, the formal operation stage. This is a stage where we expect a shift in health-related decisions from parent to child. They're starting to take control or sort more control over their own health. Often they have questions about their developing body and sexuality. So if so, it's a great opportunity to teach if you have that opportunity. They're emotionally vulnerable. They're kind of between childhood and adulthood. Can be expressed as withdrawal, rebellion, lost motivation, and rapid mood changes. They're dealing with a lot at that stage. It's often difficult to communicate with care providers at this time. They often want to be treated like an adult, but also want the security of being able to retreat into childhood when they're overwhelmed. Always ask before touching an adolescent and talk directly to them. Validate their perceptions, emotions, and priorities. They may be more concerned with the ability to play a sport or how the illness will affect their looks than actual what's going to happen with the illness. Demonstrate empathy for all ages. Simple, straightforward language, free of jargon, but also avoid baby talk. Encourage access to peers, phone, computer, wear on clothes, fixing hair. And an adolescent can be prepared for procedure days in advance. So let them know a few days ahead, if you have that opportunity, what's going to be happening, because they may prefer to have time to think about it and actually get ready for that procedure. Identify rage as a normal response to a difficult situation can be reassuring. Privacy is very, very important at this stage, so never embarrass them. If you're going to talk about something that requires privacy, please ask the parents to leave. Ask direct questions about drugs and sex. And again, this is probably a time when you want the parents out of the room. Compassion, concern, and respect from healthcare provider. They're looking for that. Ask open-ended questions. This is a really important strategy for teens. Be direct. Because of a lack of life experience, teens don't understand life has ups and downs. So teen suicide is now the second leading cause of death amongst teenagers. So look for those signs of apathy, depression, or some self-destructive behavior. Now, Illness may lead to significant alterations in role, relationships within family and peers. A sick child puts strain on a family, and families who do not have good coping skills will not cope well. Children can express a wide variety of behaviors in response to an illness, and their behaviors can range from shy to curious, happy, but initially untrusting, to avoidant and non-engaging. Some others are separation anxiety, like clinging when separated from a loved one. Regression often is seen as bedwetting. Guilt, they look at the illness as a punishment. Fantasies in hope that their reality is not real, what's happening to them. And you're often going to see tantrums. But in assessing the child's reaction to illness, look at the interaction between the parent and child. For many children, especially younger ones, their parents are their main coping mechanism for unfamiliar circumstances. And at some point during their illness, they may have to be separated from their parent, which causes anxiety, often tearful reactions. But it's not only the children who has to cope with an illness, it's also the parents. And you're probably going to see initial shock, disbelief, denial. They're going to go through a grieving period, depending on the severity of their child's illness. They may become emotionally distant, not just to you, but also to the child. They're going to mourn the loss of their perfect child. So they're going to go through the stages of grieving. Guilt, they may blame themselves for what's gone wrong. Could be confused, frightened, angry. They often may blame you or the staff and the doctors. They feel helpless and lost. A family needs support. They need to learn new interactional patterns and coping strategies that take into the consideration the meaning of an illness and disability in family life. So they're going to need explanations, more information. Remember, information is power. So the more information we can give them, the better prepared they are to do it. An ill child causes parental stress. So establish trust. Let them feel some sense of control. Let them make some decisions. They want to be involved with care, but not pressured. So allow them to do what they want to do at that time. Let them know what community sports are available for them. They're going to go through a lot during this time. I mean, their siblings may be jealous. You do not want to blame them or judge them. They're coping. They're doing the best they can probably do at that time. Always provide positive comments. Provide encouragement. Allow parents time to express emotions away from the child. So, let them tell you how they're actually feeling, and let them know their feelings are normal. So listen actively. Be engaged in these conversations. Be genuine. Tell the truth. Show respect. Provide anticipatory guidance to the child and parent. So anticipate what the information they're going to need and give it to them before. And lastly, always acknowledge the feelings of the ill child and the family. It's their reality at the time, and what they're feeling is really important to them. Anyway, that was a quick go through for the topic 5.2. The next topic deals with the older adult.